Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's episode, we're going to be discussing a medication known as Pindolol, or Visken as a brand name. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. In this presentation, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe Pindolol to a patient, followed by contraindications or reasons we would not be able to prescribe this medication. Then touch on examples of dosing, and then finish it off with side effects with percentages. I've put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So Pindolol is a non-selective beta adrenergic blocker. It is believed to affect the central nervous system, leading to a reduction of sympathetic outflow to the periphery. It reduces cardiac output and also inhibits renin secretion from the kidney. In terms of indications or reasons we would prescribe this medication to a patient, we often see this medication used in the treatment of hypertension or high blood pressure. Also, there is established dosing for chronic angina pectoris or chest pain, as well as hyperthyroidism. With respect to contraindications or reasons we would not be able to prescribe Pindolol, we wouldn't give this medication to a patient who had cardiogenic shock or overt cardiac failure. If a patient had second or third degree atrioventricular block, they would not use this medication, as well as patients who had bronchial asthma or COPD. Finally, if a patient had severe sinus bradycardia, they would also not use Pindolol. Now for some examples of dosing. So in the treatment of hypertension, the initial dose would be 5 milligrams orally twice daily. The patient may increase the dose by 10 milligrams per day at 3 to 4 week intervals to a maximum of 60 milligrams per day. In chronic angina pectoris or chest pain, the initial dose would be 2.5 to 5 milligrams orally daily, with a maintenance dose of 10 to 40 milligrams orally in divided doses. In the treatment of hyperthyroidism, we may see 15 to 30 milligrams orally daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Pindolol, so we'll go over some of those here now. 9% of patients may experience dizziness, while 8% may experience fatigue. 6 to 16% of the time, a patient may experience edema. Arthralgia or joint pain may happen 7% of the time, and myalgia or muscle pain may happen 10% of the time. Nervousness comes in at 7%, and insomnia at 10%. Now, a more serious side effect would be heart failure, which would happen less than 1% of the time. Alright everybody, that's all we're going to talk about today with Pindolol or Visken. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.